Welcome back to the channel. My name is Steven. I'm a pharmacist and I own 52 units of real estate. So I got you guys' feedback. I'm gonna try to stay closer to the mic, so hopefully it's louder. So if you see me hunching over, that's why. But I had a great question in the comments in response to I got laid off twice in 1 year video as a pharmacist, and he was asking my thoughts on pharmacists potentially being replaced by AI. So I know AI is a very popular topic, and just want to give my insight as somebody who's been a pharmacist for 11 years now. Full disclosure, I've started off as an intern when I was in pharmacy school working at like Rite Aid, and I realized that retail pharmacy, so that's Walgreens, CVS, Rite Aid, that's what most people view as pharmacists or know as pharmacists. You know, the guy in the white coat or girl in the white coat behind the counter, and we just process your insurance, and then we just give you some pills and consult you, right? And maybe give you some vaccines as well. So that's kind of the cookie cutter, what most people think as pharmacists. And that was my opinion too, to be honest. Even when I was in pharmacy school, like that's all you see, right? You just go to Rite Aid, you go to Walgreens, you go to CVS, and you just see someone in a white coat behind the counter, and they ask you to wait for like 30 minutes, and you get angry, and there's an insurance issue or your copay went up. So, it's a lot of, customer service front facing, or the classic where you drive up to the drive through window and then no one acknowledges you, right? And then you're staring at that like white coat, like, you bastard, why aren't you acknowledging me? And why are you making me wait, right? So that's what most people view as a pharmacist. So the retail pharmacist, or outpatient pharmacist is what we call it, is the typical job is pretty simple. You get a script, right, from a doctor, electronic script or a physical script. The technician will type it up. The pharmacist will verify the script against what was typed. And then the tech will then fill the drug, and then the pharmacist will then check the drug, give it to the patient, and if the patient wants a consultation, or it's required for a consultation, then basically the pharmacist will give that consultation. The pharmacist will give vaccines if you want your flu vaccine, right? So that's your pretty cookie cutter outpatient retail pharmacist. This job, I think it's more maybe more replaceable by AI in the future. And why I kind of share that, because I work in the hospital my whole career, right? Because that's more for me. That's kind of my cup of tea. So a lot of people don't know that you have your CVS, Walgreens pharmacist. That's your cookie cutter. You have your inpatient hospital pharmacist. So this is when jobs get a little bit more clinical and a little bit more, I guess, hard to replace, I would say. So in the hospital, so when you get like a IV bag or IV drip of medications, that usually comes from the hospital pharmacy. So usually, a doctor, puts in an order for, let's just say, an IV antibiotic or intravenous antibiotic. A common one is like ceftriaxone. And let's say you have like pneumonia or something, right? And the doctor will place the order into the electronic system. The pharmacist will verify the order, make sure there's no interactions and all that. So obviously AI could do that too, right? And then from there, a label will print out. The tech will grab the label, will compound it, and then a pharmacist will check it before it's sent out to the floor for the nurse to give it to the patient. So, and then that's kind of the basic function in the hospital. The more advanced function in the hospital is you have clinical pharmacists who round with the physicians. So, physicians, they round every morning, typically around 9 to noon. And part of the team, it's multidisciplinary. So, you have the nurse reporting out, you have the physician residents, you have the attending physician, you might have a respiratory therapist, you might have lab there, you might have a dietitian there, and you might have a pharmacist there. So at that point, a lot of the pharmacists are help dictating, recommendations. So, doctors, to be honest, they know like the first, second line options, right? That's easy. But where the pharmacist gives value is a third, fourth, fifth line options, right? You failed option A, you failed option B. What's option C and D, right? So that's where the pharmacist gives the most value, and it's going down the risk versus benefit, right? And based on the disease states, as well as pharmacists we're pharmacologic experts, right? So we know how drugs interact and how they affect each other much more deeply compared to physicians, right? Because that's what we study. Like For context, physicians maybe do like one class of pharmacology versus in pharmacy school, like we do like 5 classes of pharmacology per semester, and times that by 6 semesters. So that's where it really starts to like stack up, right? So we take 30 classes of pharmacology. So, we know that better. And that's another function, right? We have oncology pharmacists who actually, they initiate the treatment plans and they schedule all the like pre-medications. Because when you're on chemotherapy, you get nauseous, right? You have inflammation, there's swelling, there's lab requirements. So pharmacy, we're actually the ones doing all that back end monitoring, and we're telling the oncologist what we would suggest, right? So it's very collaborative in the hospital, right? So this is in the hospital setting. And then there's an infectious disease pharmacist where they work with the infectious disease team, medical team, and they're making recommendations on which antibiotics to use. How long is therapy? What's the dose? How do I adjust it? Is it time to switch antibiotics if they're not working? Like, I don't know how many times as a pharmacist, a doctor prescribed an antibiotic and 3 days later we do cultures and find out that that antibiotic doesn't work. So we recommend an antibiotic that does work, right? And if we don't catch that, then the patient's on the wrong antibiotic and the infection will get worse and they'll stay in the hospital longer, right? So there's a lot of behind the scenes things that pharmacist does in the hospital that don't really get noticed. And most people don't know about it, including myself when I went into pharmacy, right? So like, if like big hospitals, I kind of call pharmacists in the hospital, we're like kind of that safety net of the hospital. Like if the doctor made a mistake, we'll catch it. If the nurse makes a mistake, we're there to help support them, right? So, we're just the extra set of eyes that we know. Like there's some medications like IV mannitol, which is used when you have a head trauma to relieve the brain pressure. And that thing crystallizes, right? So like when we check it, we know that it crystallizes and what to do. So, I would say in the hospital setting, it's probably harder to replace pharmacists with AI versus in the outpatient CVS Walgreens, a little bit more replaceable out there. And actually in the hospital setting, which a lot of people don't know, is we actually have something called tech check tech. So a tech will pull a medication off the drug shelf, and then another tech will check that without a pharmacist, right? So they undergo additional training. And after that, the tech that originally pulled it, a tech checked it, a different tech checked it, and then it's delivered into this like automated dispensing cabinet. So it's like kind of like a vending machine of medications that's on the nursing units. So in order to load that medication into that vending machine or automated dispensing cabinet, they have to scan it, it verifies it, and then it goes into the machine. When the nurse pulls it, she checks it's the right one, then gives it to the patient, right? And then scans it as well before being administered. So, in that aspect, tech check check array does exist in the hospital setting. So will it go to retail pharmacy? I think so, right? Like a lot of times in retail pharmacy, you'll see there's a big machine called Script Pro where it'll actually get the prescription, and if a drug's in there, it'll actually like pop out a bottle, it'll fill the drug, one tech checks it, another tech can check it, and then maybe we can dispense it to the patient, right? So that could be in the future, but right now, how the laws are currently written, so laws can change, right? And the laws could, in fact, implement that so that you don't need as many pharmacists, right? Because why do you want to pay a pharmacist $75 an hour in California when you can pay a tech $25 an hour, right? You can have 3 techs for the price of 1 pharmacist. However, I will preface the current law right now, at least in California, is that there's racial requirements in outpatient pharmacy like CVS Walgreens. So if there's 1 pharmacist, there's 1 technician, I believe. If there's 2 pharmacists, at that point you can have 3 technicians, right? So that's the supervision that you have. With that, in the hospital, it's a lot more generous and liberal because pharmacists are doing a lot more clinical duties. So I will agree that I think AI will replace more outpatient pharmacists, but in terms of inpatient pharmacists, it may not get there yet, right? It'll take a little bit longer with that. So, that's just kind of my opinion. And there's other professions that pharmacists do that not many people do. No, right? Like as a pharmacist, you could work for drug companies, right? That's kind of called like big pharma. So you can work for like Gilead, you can work for like Genentech, all those big pharmaceutical companies that you hear of. You can work there as a pharmacist, and you're just talking to doctors about the drugs and why you should use it, what the benefit of it is, talk about drug studies. So that's another niche that's like kind of popular. As a pharmacist, you could work in there's a lot of radiological medications that you can do. as a pharmacist. There's something called ambulatory care pharmacists, which is very well known in Kaiser. So pharmacists have protocols where we adjust, drugs like warfarin, or we can adjust your like blood pressure medications like metoprolol, lisinopril. We can adjust your high cholesterol medications like torvastatin, Crestor, all these common drugs. So Kaiser is really big on that model where we have pharmacist protocols where we can, in collaboration with physician, adjust medications to free up the physicians to do what they do best, right, which is diagnosing patients. So, when I was a student, actually was as an intern at an HIV clinic, and oh my God, I could prescribe almost anything I wanted under a protocol, right? A physician had to countersign me, but I was basically prescribing, antibiotics for rashes. I was prescribing blood pressure medications. I was prescribing like medications for nerve pain, right? But I had to discuss with my lead pharmacist as well as with the physician before making that change, right? So I think AI isn't gonna. I think it's a take away a lot of the more distributive jobs. Like if you work at like CVS, Walgreens, maybe you're more at risk, but it frees up pharmacists to do more clinical duties, right? Doing medication therapy management, because a lot of elderly patients, they're on like 10, 15 medications, and no one really knows what medications they're on, including the patients themselves. So that's where the pharmacists get the most value. So I do see AI coming in and affecting pharmacists. And just from my experience, being in the profession, like there was a huge demand. I would say like prior to 2010, I graduated in 2013. There was so much demand that like if you wanted to get a job and you were willing to work in an undesirable area, like it'd be like Bakersfield, Fresno, man, they'd give you like a $30,000 sign-on bonus and a job, right? So you get like a nice new BMW and a job. And nowadays there's no like sign-on bonus. And if you want a job, you have to kind of go to those remote areas that no one wants to be in, like Bakersfield, for example. So and a lot of pharmacy schools popped up in California specifically. I'm sure nationwide. I think when I went to pharmacy school, it was like maybe 8 or 9, and now there's like 15. And I think admission rates are going down now. So unfortunately, pharmacists are being more diluted because there's more schools now, and admission rates are going down. So a lot of schools to stay profitable, they're like just accepting everybody. So I think the next generation of pharmacists are not going to be as strong because the requirements to get in is not stringent, right? So, I heard of like admission or applications going down for pharmacists. So I think there might be an oversupply coming soon. So, for me, luckily, that's why I'm in management, right? Because like not many people want to do that. And also on top of that, like I do a lot of side hustles, right? I do real estate. I do, YouTube now and coaching and all that because like I want to diversify myself in case like my skills become replaced. I still have other streams of income that I can lean back on, right? So that's why I'm really big on having multiple streams of income and diversifying your skill set, right? That's why I do real estate. That's why I do other things. So, like kind of the question now is, would I become a pharmacist today? Like if I was, let's say, in high school, I think my answer would actually be no. I think it's oversaturated now in California. There's so many schools, and to be honest, like in California, probably the best profession is probably nursing, right? It's because nursing has ratios built in, right? It's like in a regular hospital, it's like one nurse, 5 patients. If you're like in a intensive care unit, the ICU, it's like one nurse, 2 patients. Some units is one nurse, 1 patient, right? And in California specifically, I'm talking about like the Bay Area. And I'm not sure if you guys know Nurses to Riches, but I was on his podcast a few times. But like, yeah, basically nurses get paid a lot in like the Bay Area, Sacramento area. They make as much as a pharmacist. Like I think a pharmacist makes like starting maybe 70, $80 an hour. And some nurses, if you work for, some hospitals, they pay you 70, $80 an hour. And it's a lot faster to become a nurse than it is to become a pharmacist, right? But it's more people involvement, right? Most pharmacists, we're introverted, we're detail oriented. We like to kind of be behind the scenes. That's why we chose the profession. Versus nursing, you have to be more extroverted. You have to talk to patients, talk to families, talk to doctors, talk to pharmacists, talk to everybody. They're the coordinator, right? So nurses in California, they make a lot of money, right? And there's always a demand for nurses. Versus if you go out of state like Florida, yeah, nurses in Florida don't get paid that much, but pharmacists still get paid around like, 50, $60 an hour, right? So if you're in California, I probably wouldn't. Like I'd probably be a nurse if you want to go into healthcare. because like I said, I think like retail pharmacy is slowly trending downwards. Obviously as people want mail order pharmacies, like I don't want to, like for me, if I need drugs, I wouldn't want to go into a pharmacy to pick it up unless I want it immediately, right? For like antibiotics. But if it's my routine medications, they can mail you a 90-day supply, right? And it's you need less bodies to operate a mail order pharmacy versus like a CVS Walgreens. That's why a lot of CVS Walgreens, they're closing in unfortunately like rougher areas because the stores keep on getting like broken into. You steal all the narcotics, and they just don't want to deal with that. That's why they're closing down stores in rough areas, right? And that unfortunately creates a medical desert, right? Because and so it's kind of like going down that way. And in hospitals, there's only so many number of jobs, right? Like once someone has a job there, for the most part, they don't want to leave that job, right? And they're not growing as much either. And in hospitals, reimbursement's getting tougher, right? So like, we provide these services, reimbursement's getting tougher. So profit margins are thinner. So, when they're looking to cut, like they're going to look at every department. And pharmacists, we're like high income, right? And a lot of bodies, and they're like, what do you do? So, we're usually pharmacists, they're the first department to be targeted, as well as other departments as well, right? So like middle management. And so, for me, like that's why I wouldn't do it today, but I'm glad I got in when I got in. So it's just something to consider, right? And you come out with like $3,000 of student debt, right? Becoming a pharmacist versus you can become a nurse, come out with less debt. And nurses, they work 312s. Pharmacists, you have to work 5/8 or 4/10s at best, or some pharmacists work 312s, right? So it just gives you more options. But like you said, you have to want to do it. So that's why for me, when I went to pharmacy, like honestly, I just didn't really think too much about it. I was just like, well, it's 5 years and I'm out as a pharmacist. I didn't want to be a nurse. I didn't want to be a doctor. So I just thought it was like a happy middle ground. And, I'm glad I did it at the time because I came out fast. I was able to make money. And then I started investing into like real estate and doing side businesses and starting YouTube and sharing my journey. But I think just the dedication it takes to become a pharmacist, I think says a lot about your character. So I think you can, achieve whatever you want to achieve. And, a lot of doctors, I will say, like the work-life balance is terrible for doctors, right? Like you sacrifice you have 4 years undergrad, you got 4 years of med school, you got 4-year residency at least. Like one of my best friends is doing like 7-year residency plus fellowship, right? And then when you graduate, you're in your mid-30s, and you kind of feel behind because you haven't made much money, right? And then like don't get me wrong, like we need doctors out there, and there's always job security as being a physician. There's probably more job security as a physician as a pharmacist, right? But you really have to want to do it because like like for me, I've been making money for like 11 years, like actual money over the past 11 years versus the doctors. They don't make money to their mid-30s, but when they start making money, it's like insane amount of money, right? Like $500,000. Depends on what specialty you're doing, right? Like I wouldn't want to be a physician unless I'm in a specialty, right? Like if you're just a normal physician, like a pediatrician or a hospitalist, like they don't make that much more than pharmacists, and they have to do way more schooling. And obviously, but you have more prestige as a physician, right, versus a pharmacist. No one respects a pharmacist as much. So like if you're a specialist, like a radiologist or urologist or orthopedic surgeon, yeah, you're making $500,000 plus, right? Dermatologists make like $600,000, $700,000. But like you said, it depends on that balance and all that school. So you have to want to do it, right? So for me, like it was just like a nice work-life balance. Like I put in my hours, and then after that, I just spend the rest of my time doing what I want to do, or I do like my side hustles, my side businesses. So yeah, that's kind of my outlook on pharmacy. I don't think AI will really affect pharmacy in the next like 20, 30 years. I mean, pharmacy is growing rapidly as a profession. But things move very slowly in healthcare, as I've learned, compared to like tech. So it's still not bad, but yeah, if I had to pick, yeah, probably nursing it is less replaceable by AI. Doctors are less replaceable by AI if you like direct patient care, versus pharmacists we're more behind the scenes. So yeah, it potentially is more replaceable with AI, especially in the retail pharmacy space. So that's just kind of my thoughts. Being in the pharmacy profession for 11 years, like I said, I've been like a pharmacy director, currently a pharmacy manager. So I kind of see the trends, but like I also do see that like a lot of the new physicians, they're used to like working with pharmacists. They're used to having pharmacists do a lot for them, which is great for the profession. And a lot of pharmacists, they kind of shot themselves in the foot because, like I said, a lot of us are introverted. So, like, they want to minimize, like, rounding. They want to be behind the scenes. But just know that when you're in a hospital, it's that hospital pharmacist that's your safety net, really, right? Because if a lot of things that, like, we catch, doctors and nurses miss, right? So, like, it's just that extra safety net, that redundancy that's built in that helps keep patients safe when they're at the hospital. So that's kind of like what I'm over a lot of, right? Is operations and medication safety to make sure that patients, their safeguards built to make sure that physicians don't make mistakes, that nurses don't make mistakes, and that other pharmacists don't make mistakes. So, it's collaborative, but, hey, if that's really what it is, what I'd recommend is just shadow multiple pharmacists. So, like, don't just do your retail, Walgreens, CVS, but go to a hospital, try to volunteer, shadow the pharmacy for a day. Go to Kaiser, shadow the ambulatory care pharmacist, like go to Big Pharma, shadow pharmacists there. There's a lot more to pharmacists than your typical white coat behind a counter counting pills, right? That's the old adage of what a pharmacist is and what most people think it is, to be honest, right? Like if you just think of pharmacist, oh, you just count pills all day. You're like a bean counter, counting fives with that little tray. But I haven't counted pills in a very long time, right? Because I work in the hospital. It's a different cup of tea. So, hopefully this gave you some insight. Anyways, nothing related to multifamily, but if you want to buy some multifamily real estate and, diversify your income because you're afraid that your job's going to be taken by AI, then consider the mentorship program down below. Otherwise, let me know what questions you have. Please like, comment, subscribe, and I hope to see you in the next one. Thank you so much.